The North Carolina General Assembly recently proposed House Bill 401, Enact Medical Cannabis Act. If passed, this law will allow marijuana to be distributed for medical purposes in North Carolina. I support House Bill 401, and I am seeking your support as well. Marijuana can be used for treatment of many medical conditions. One use of marijuana is for pain. A 2015 study published in the Canadian Family Physician Journal reviewed evidence from 6 studies and concluded that very low-dose marijuana is associated with the improvement of pain. Another use of marijuana is for nausea and vomiting. According to the International Association for Cannabinoid Medicines, 40 studies have been conducted and proved cannabis efficacy with treatment of nausea and vomiting. Multiple health conditions and medical treatments cause nausea and vomiting, such as chemotherapy, AIDS, and hepatitis. Medical marijuana has the potential to help many sick people in North Carolina. To fund this health policy, I propose to charge fees to obtain licenses and registry identification cards to grow, sell, and use marijuana. The Government Finance Officers Association supports the use of charges and fees as a method of financing goods and services and reports that well-designed charges and fees not only reduce the need for additional revenue sources, but promote service efficiency. In order to legally sell marijuana from a medical marijuana center, a person must obtain a registry identification card. The fee for the card will be $5,000 each year. Each employee of the medical marijuana center must also have an identification card that will cost $20 each year. In order to legally grow medical marijuana, a person must obtain a producer of medical marijuana license. The fee for this license will be $5,000 each year. The employees of the licensed producer of medical marijuana will also need an identification card that will cost $20 every year. In order to legally buy marijuana, a person or caregiver must obtain a prescription from a physician for a valid health condition. The prescription must be presented to obtain a medical marijuana consumer registry card. To obtain a registry card, the fee will be $10. Additional funding for this policy change will come from taxation of revenue for the medical marijuana producer and seller. Each medical marijuana producer will report monthly sales and pay 15% of the gross revenue to the state. Each medical marijuana center will also report monthly sales and pay 15% of their gross revenue to the state. The state of Colorado operates on the same taxing system for marijuana and reports collecting over $266 million of revenue in 2018. To ensure that people pay the fees, the rules of Medical Cannabis Act will be enforced by law officials. If a person is caught violating these rules, they will be charged, spend mandatory time in jail, and pay a fee of $1,000. The revenue that is collected from the Medical Cannabis Act will fund costs associated with operating the regulated medical marijuana system, the registry, and a North Carolina marijuana research program. The leftover revenue will go to the other state programs that need funding. With your support of the Enact Medical Cannabis Act, North Carolina can have a healthier population and economy.